I know we've all got a lot going on at the moment. So thanks, everyone. So as usual, I'm bound to read the filming at meetings scripts that you've all heard many times. Welcome to the meeting of the Health and Wellbeing Board. Please note this meeting is being recorded for live and subsequent broadcast via the Council Internet site. And we've done introductions. Really pleased to see you all here. Thanks for coming, and special thank you to Francis for coming today. Brilliant to see you here. Thank you. Do we have apologies for absence, Naz?
Yes, we have apologies that were received from David Archibald and Sina Etheridge.
Thank you, thanks, Naz. And we do have our two practices in the room, so we're now quorate, so we will proceed formally under quorate status. Thanks, everyone. Do we have any items of urgent business?
No items.
Any declarations of interest anyone would like to make? No, thank you. And did we have any questions, deputations or petitions? Okay, so straight on in that case to the minutes of the last meeting. Do we have any comments or questions on accuracy, etc. for the last set of minutes? No?
No.
In which case then we will accept those as a good, correct record. And so I'll just introduce while my colleagues settle down and fire up their laptops that we have Katsasina Brabison here.
Apologies, we'll call for the traffic. So
I think it's because it's the sunshine. Everyone's enjoying the sunshine and going out, and maybe. So Katsasina Brabison here and Katsasina Vicato. So thank you both for joining us. Okay, so first into our first item, the COVID vaccinations update. Will.
Hi everyone, yes, so I'm Will Maris, Director of Public Health. We've got a really busy agenda, so I'm just going to give a really quick update. So I'm going to talk about COVID rates, and I'm going to talk a little bit about vaccination programme. So things are looking considerably more positive than they were before Christmas on the COVID front. Having said that, COVID cases are still high in Haringey, London, in England, driven by the Omicron variant, but they're now starting to fall considerably. Our weekly rate is quite high in the grand scheme of things at just under 800 cases per 100,000 per week. And our rate in older people is 346 per 100,000 per week, but they're declining. The metrics are heading in the right direction. The positivity of tests is down, which also suggests this is not just about kind of testing behaviour and people getting less tests. It's a real decrease, and that's borne out in other data like surveys from ONS. Still lots of pressure on the health and care system from COVID, and of course it's winter, so from a variety of other directions as well. But it looks like the peak of admissions has passed in early January. The latest data I have is there are 90 patients in Whittington with COVID, 8 in intensive care, and 128 in North Middlesex with COVID, and 4 in intensive care. And that compares to about 300 patients in North Mid and over 200 in the peak last winter. And of note, the severity of Omicron does seem to be significantly less than previous variants, even allowing for the increased vaccination rates in the population. So while we've seen a significant number of cases, we haven't seen a significant number of excess deaths and a large number of people seriously unwell in ITU. So things are looking more positive, and we expect rates to come down further in the next 4 to 6 weeks. Having said that, we do still have seriously ill people with COVID, and there is a risk new variants will occur in the coming months. The rates of COVID in the community are also putting significant strain on health and care services and schools and other sectors because of the number of people infected and having to self-isolate. And although some pressures are starting to alleviate in some parts of the system, we're not kind of past the worst of it. I'm going to come to vaccinations later on, which are a really important part of our response. But I think the government is keen to release restrictions very quickly. So do things like going back into offices. However, because of the uncertainty, because there's still risk of new variants, we still have to emphasise those key messages around sort of hands, face space and ventilation. On vaccination, we've made real strides in Haringey, particularly just before Christmas and over Christmas on the booster vaccination. So 65% of eligible patients have had their booster vaccine, and over 80% of over 60s eligible for their booster have had their booster vaccine. And in older age groups, we've managed to narrow inequalities between different groups. We still have real challenges in first, second and booster vaccinations in younger people, and there is different impacts in different communities, particularly Eastern European and some of our Black African and Black Caribbean communities. We continue to do work on that. We have tried a number of different avenues. We continue to work with our communities, work with different languages, have a kind of evergreen offer where people can get their vaccines, but demand is low. So it's something where we're just going to have to continue to chip away. The other thing to mention on vaccinations is around compulsory vaccination of health and care workers, which is a real challenge for the system, and it's become really a national issue in terms of risks, in terms of implications for staff in a number of sectors. So there's lots of work going on locally to plan for that and to mitigate any risks, but there is also a national conversation around whether that needs a delay just because of the potential risks to health and care delivery. So I'm going to end my update there. Thank you.
Thanks very much, Will. A few things I wanted to ask, and then I'll invite some others in. Well, the first thing I wanted to say was actually thanks to you all and to all our health and care staff for all your efforts and all your team's efforts. I know it continues to be very challenging, so thank you. I had a couple of questions. One was whether or not we're seeing the rise that's been seen elsewhere in COVID amongst children, especially young primary school age children. So I was wondering if we're seeing that in the borough or elsewhere in London. And my other question was where we're at. I've had a few queries now from residents on vaccination for the under 12s, availability, issues with availability for those who are clinically vulnerable, but also when all will be able to vaccinate. And I suppose as a parent of a child who might go to secondary, I know some parents are concerned that their children will go to secondary and be unvaccinated when the vast population of children in secondary schools will be vaccinated. So a question about whether or not there's a plan coming along the way for that as well.
So on the first question, so rates in primary school children are high, and there was an increase following the Christmas holidays, which kind of bucks the trend. Of course, we're doing lots and lots of testing in primary schools, which is part of the explanation. I do expect those rates to kind of decline over the next few weeks, but yes, that is in that age group we are seeing high case rates. Not interestingly in secondary school children where the trend is being followed. I might ask others to comment on the mechanism for under 12s. I know that there's different routes for getting vaccination for the clinically vulnerable, and it's a really good question on the kind of ongoing plans to sort of keep vaccinating 12, universally 12 years and up. At the moment, we're focused on the second dose going into existing secondary school children for the sort of 12 to 16s. And I'm not aware of any sort of future plans as yet for that kind of ongoing catch up as children move into secondary school. So that's a very good question. I don't know if any other colleagues from the NHS side want to come in for the sort of under 12s question.
I'm taking that being as we're not sure. We don't know yet.
Could I ask a question related to that?
Yeah, I did have Jeffrey first.
Oh, I beg your pardon.
I'll just take Jeffrey if that's okay. Jeffrey and then you and then Lynette if that's okay. Jeffrey.
Thanks, Chair. Thanks, Will, for the presentation. Good to see the trend going down. This is probably a difficult question, but it's a question we get asked not just by staff, but by other residents as well. To what extent is the easing of restriction driven or supported by the science? Because if that's the case, it gives people more confidence and so forth and so forth. And to what extent actually is it a political decision? You might not want to answer some of these bits, but because I think that drives the confidence that people have to be able to either associate or not associate really, but also to what extent they can participate in different activities. Thank you.
So my own personal view is it is appropriate to remove restrictions just because of the impact in terms of severity is lower. However, of course, that has to be balanced out that COVID still has an impact, particularly on certain groups and vulnerable people. But for me, it's really important that we get back to as much normality as possible. and you know while the NHS is kind of strained and COVID is putting additional strain on it, I don't think that's balanced out by the need for sort of further restrictions and the potential harm that can cause. But there would be different views in the scientific community, but that's my view, is that it is appropriate.
I'm just, Cassie, do you want to come in on this as on the answer to a question, or do you have a separate question?
I was going to come in on vaccination rates for and accessibility of appointments for the 5 to 11-year-olds, which I think relates to a previous question rather than this. Apologies, I came in late.
No, that's okay. Do you want to come in now then and just answer that, and then we'll pick up Jeffrey's?
Absolutely. So just at the moment, there is good capacity in both of our sites in terms of appointments and also downstairs. And I think all the pharmacies are offering lots and lots of appointments explicitly around the 5 to 11-year-olds. Not all the sites are able to do that. However, I can confirm that both Bounds Green and Lordship Lane have agreed to support this. They have already started to vaccinate the at-risk 5 to 11-year-olds. This is called off-label, so they do it with a specific conversation with the patient when they're at risk. So they've started to do that. From next week, we're getting the paediatric dose, and all our practices will start to formally invite the patients between 5 and 11, and they will come in, and there's good capacity for that. Both sites, so we've got weekend appointments and we've got appointments that would be after school. So the initial searches, though, need some filtering because they suggest there's a larger cohort than there actually is, but at the moment there's good capacity.
Thanks, Cassie. That's really helpful. Could you be really clear on how families should access that? Because I think that's some of the questions that we've been getting, certainly I've had as a counsellor, how they achieve that, and also whether or not that comprises the children of clinically vulnerable people or just clinically vulnerable children, just to be really clear, because that's another question that we're getting.
So it's children of the immunocompromised, so severely immunocompromised, which is not just clinically vulnerable people, but those who have a proper problem with their immune system. And in terms of how they get it, at the moment, the reason that our practices haven't yet gone out is because we didn't have that paediatric dose. So we didn't want a whole lot of children coming in who were going to have the vaccine with a specific conversation with the GP. So from next week, they should get invites. But in the interim, they should just call up their practice if they believe that their child falls into this category. And then the practice should direct them through to our team, and then we can book them in. Or by next week, hopefully the practice themselves will be able to just book them into appointments.
Thanks, that's really, really helpful, and that's really clear, Cassie. Another, just to follow up on that, do we have any indication of when vaccination for under 12s more widely might occur?
So this is not yet confirmed, but the indication we've received is that's likely to be in April, but that could change at any point. I think quite a lot of us would prefer it was a bit sooner, but that's what we've currently been told.
Okay, thanks, Cassie. I'm going to bring Councillor Brabazon, who had a related question.
Oh, you asked most of my questions, Lucia, but
sorry.
If I could follow up. My understanding was at the moment the paediatric inoculations were only for children who were vulnerable or came with vulnerable settings, so we can confirm that. But are we letting our special schools know? Are they notified about the new arrangements and when the paediatric dose is coming? How is that being organised? Because of course the schools, are like direct men, really. They can communicate directly with families and also talk to families. They are pivotal in all of this. So could you spell out what the sort of the organisational arrangements are to promote this? Lucia asked my other questions about which groups of children and when, but I would like to know how you're liaising with the schools and the children's services.
So because we are yet to receive that formal paediatric dose, we're yet to go out and yet to advertise anything more broadly, but that will be happening at the end of this week and the beginning of next. So at the moment, we've only responded to direct requests that have come through GPs from parents. As of next week, invites should be starting to go out to those families from their GP practice. That will be in the form of a text. However, you make a really good point that alerting special schools would be a really useful way of ensuring that we maximise the opportunity. Obviously, it'll need to be very clear that all of those children would actually be eligible for the dose. And I don't know for sure if that would be the case, although I think it's highly likely that a large proportion would. And so I think that's probably something we need to pick up outside of this meeting with the CCG and local authority to make sure that we're making those links and we're giving the communication to support ensuring we get as many of these children vaccinated as possible.
Could I come back, Terry, the second point? Children's services through schools and learning, our schools and learning section, if you like, does weekly briefing. We do weekly briefings with all the heads in secondary, primary, special. And of course, we have children who are vulnerable in mainstream also, who may well be eligible, you know, children with a range of needs, but who may fall within that. I don't know what NICE is in determination is of what constitutes vulnerable 5 to 11-year-old, you know, I'm not in that particular world. However, if there's stuff going on, if you liaise with Evelyn Riordan, she meets with schools all the time, and I really think we have got to make sure that we've got this sorted out, because these children, you know, vulnerable groups, and I see Anne Graham's on the call, and Anne may want to come in here. It just sounds to me like it's coming out, but there's not much, we need the liaison. I'm not trying to be unkind or difficult. We just need to be sure that everybody's liaising over this, given the rising cases in the younger children.
Before I bring Anne in, because I think Amanda might want to say something, I just wanted to emphasise as well that we've been contacted by a lot of clinically vulnerable families as well. Their parents are, and schools have been at the front line of having to address and deal with that issue, if you like, the issue that some families will find it difficult to send their children into a very perhaps COVID positive environment when it puts great risk, perhaps even risk of death, to parents. So I think that the role of schools and making sure that schools know both what the criteria is and that there is that availability for those children as well, I think is really important. But Anne, you might want to come in.
Thank you very much, Councillor and Cassie. Absolutely, Cassie, very happy to speak with you outside of here to be sure that we have the information. We have a week, as Councillor Brabazon says, we have a weekly bulletin that goes out to all schools, well, to all head teachers and through that schools. We've been doing this since March 2022. There's also a public health section in there that we could double check to be sure that this is covered, but if not, we can make sure it's allied. When we were working with food poverty, we had an extensive communication approach to be sure that we had information on the council website, on other websites, so we can look to consider putting that sort of approach back in place again. But let's speak outside of here so that we can be sure that every I and crossed or dotted and every T is dotted or crossed. I think you know what I'm trying to say. Thank you.
Now, I had a few other questions, but before I bring them in, Rachel, I can see you've got your hand up. Do you want?
I only wanted to come in really quickly, just to say that we have got a strategic group that does. Oh, I seem to have frozen. Can you hear me?
We can hear you.
Yeah. Okay. That has been doing quite a lot of that coordinating with schools on vaccines. Obviously, this is a bit of a new challenge because there's the categorisation of clinically extremely vulnerable and the timing, but we will do that kind of coordination through the vaccine strategic group, and it's been very good. I think the links with the comms team, so that we have all of the up-to-date information in a single point on the council website that we can refer people to. So to recognise that you're right, this is a really, every time everything changes, we need to update our information and our communication, and this is another of those frontiers. So we will do that, but we have also got those established links from previous communications out to schools and to the special schools.
Thanks very much, Rachel. I have Lynette, and then I've got Sharon.
Yeah, sorry. It was just, Will, in respect to some of the figures that you spoke about there and the people that are in hospital, I just wanted to get a sense of whether that was the people in our more deprived wards or the BAME community, because right at the beginning of this 2-year journey, they were the people being more adversely affected by crowded conditions, intergenerational living, etc. So I just wondered if that was a feature of those figures and stats that you have at the moment.
So I don't have the data to show that locally. I think nationally there is some data emerging that that those groups have been affected disproportionately in this wave as well as in previous waves. Primarily people who are unvaccinated seem to be at more risk, and then older people as well, the main risk factors. And the numbers of people who are severely ill and dying is low. We can get feedback from our hospital colleagues to see if there's any anecdotal evidence, qualitative evidence, but I don't have that to hand at the moment.
Jonathan.
Yeah, just to say, unfortunately, we don't have that data on a regular basis, so I can't answer that question right now in terms of our hospital. I did just put into the chat, though, the numbers are definitely coming down, as Will said, and we now only have 48 positive in Whittington, so that's really positive.
That might be something that we'd like to look at, and it might be part of a bigger piece of something around looking at impact on the community. It probably connects with quite a lot of other things we might be doing, but so I think it's a really vital question. Thanks, Lynette. Sharon.
Yeah, obviously delighted to see that things are looking a lot more positive in the borough. But a couple of questions. First of all, there's certainly been periods in the last month or so when testing kits have been in short supply. Have we now resolved that? Are they readily available? Secondly, there's certainly been some rumours that testing kits might have to be paid for at some point. And I think that we would all be quite aghast if that was to happen, and if there was any kind of deterrent to people testing. And thirdly, in terms of your statistics, it seems to me they're only as accurate as people actually report if they have tested positive. And certainly over the Christmas period, I think an awful lot of people tested positive, although they weren't feeling particularly ill. And because everybody else seemed to be getting it, they didn't actually bother to report that they tested positive. And it doesn't seem to me that there's any pressure on people to report if they have tested positive, or any messages that go out there to people. And I think there will be reluctance on some people's part to report a positive test, and all the more reluctant if they're people that aren't particularly digitally enabled and can't work out how to do it. So I think our stats and our monitoring of the situation is really important. And if there are flaws in the reporting, I think that's something which needs to be kept on the table as to how we resolve that and encourage people to report.
Thanks, Sharon.
So I'll just come back really quickly. So the testing, just in terms of availability of tests, the situation has improved significantly. So pharmacies, online, our own collection points have good supplies of lateral flow tests. We don't know what's going to happen with the wider testing policy. I expect the government to review a number of different policies around testing, isolation, etc., particularly in the light of Omicron. And on the data point, you make a really good point, particularly as now a lot of the positive tests arise from lateral flow tests. A big incentive seems to me if people have work and they want, and they're taking time off work and they're declaring it, but then others may not want to do that and may not want to tell their employer and may continue to go into work. So it's something to look at. In terms of the data, we do have other ways of looking at prevalence. So the surveys that are done by Office of National Statistics, which are kind of blanket surveys, as well as the positivity rate, and all of those things are heading in the right direction as well. But a good point around the reporting of testing. I think it will remain inconsistent because of the fundamentals of behavioural incentives around it.
But so I'm just I think that there is a bit of a commerce challenge there, so that we could look at locally in Haringey to push people to report if they do test positive, and to explain to people that we can better manage the situation if we've got an accurate picture. So, and I haven't noticed any comms on that issue at all, actually, about the need to report if you're positive.
No, you're right. Our messaging is around kind of test, self-isolate. So it's something we could look into including in our messaging to register your test as well.
Yeah, and I think I just wanted to make a remark on that, which is a couple of people have informally remarked to me around the pressure they now feel from employers since the isolation rules changed, in a sense that you can, if you test negative, you can go back to work. And what people are telling, a little bit of informal feedback, is that employers saying, well, are you negative yet? Are you negative? There's an implicit lot of pressure to actually be negative because they want you back at work. And there's that sense in which everything is opening up and there are less restrictions. So therefore, we can just get on with it, come in when, you know, and that maybe we're, who knows, just a throwaway comment about some of the pressures people may feel around reporting or not reporting, that they're, if they're feeling a lot of pressure from their employer. Thanks for that. I don't see any further questions, and we've got a lot on the agenda, so I'm going to suggest that we move on and say thanks, Will and the team. That's really helpful. Perhaps we can circulate, Cassie, when there's a bit more, when the paediatric doses arrive. It'd be good for members of the Health and Wellbeing Board to just have that info or material we're distributing, and certainly for me, so we've got it at hand for when we're getting inquiries, we know, and you're going to pick up with Anne later around school. So thank you for that. So we're now going to talk about the SEND strategy and the SEND inspection. And Jackie, I think this is your item.
Thank you, Councillor Desnev. So I'm hoping that the presentation is showing from the screen. And essentially it is, thank you. And I'm really conscious from looking at membership across the room that some of you will have seen this presentation before, so I'll try and move through it as swiftly as I can, and apologies for any duplication. So for anyone that doesn't know me, I'm Jackie DeFalco, and I'm the Assistant Director for Early Help Prevention in SEND, and I've come to share an update on the board following the last meeting on the work that we've done to inform our SEND strategy and written statement of action.
Thanks, Jackie. It might be just good to just give us some, because a lot of people will have seen it, give us some headlines on each slide, and then we can always come back to anything in detail when people have got questions, because I'm sure there will be. Okay.
Absolutely. So in terms of the SEND strategy, it was informed by a range of informal sessions in the summer with parents and carers hosted through Markfield, and that group of parents, and very much the intention was to discuss, are these the right priorities that should go in our SEND strategy, and what sort of actions and resources and timescales would you expect to see to deliver against these? So those are on the screen in front of you, and we also took our thinking to a range of governance boards across the education, health and care sector, and develop these 5 priorities for consultation. Incidentally, the reason that we didn't, although we've had the consultation finished in November, we didn't publish the strategy earlier because we wanted it to coincide and have a close interface with the written statement of action. And as we thought, they both replicate what they need. So in terms of that close interface and close alignment between the two. So in terms of the strategy itself, we had just under 100 respondents. Over half of those were parents and carers, and good to see that one young person took the time out to respond. And you can see a summary of the key headlines. So the vast majority agreed that the priorities were the right ones, with over half stating that priority 1 was the one that they had most aligned to. Almost all of the respondents had said that we should adopt the strategy, with just under half saying that we should adopt it but with some amendments. And you'll see on the next slide that whilst it was clear that the strategy was the right direction of travel, because of the level of dissatisfaction with the SEND system, a lot of the responses focused on operational systemic issues that parents and carers in particular wanted to address. This strategy has been informed by a range of things such as our self-evaluation, the inspection findings, a range of other feedback, and the Amaze report, which we had commissioned as a provider to look at our co-production work. Within the strategy itself, it references our work with very young children and with children with young people with autism. However, those priorities sit clearly within the early years strategy that will be going through a consultation process and the autism strategy. So this is just a summary of the feedback that I thought would be useful for you to share. Some of this is in the covering report as well, that's been enclosed in the pack. And you can see that essentially there was a clear thinking around and response around, have we got the resources to deliver against this strategy? So we know that we have increased some short-term and recurring resource to support this area of work. There was also a feeling that our key performance indicators were not also clear. So the benefits of waiting for the SEND inspection was that we could make sure that our measures very much align and that they clearly evidence the impact and progress we expect to be making. As I said, the concerns were mainly on operational issues. And what this has told us is that whilst we fundamentally have to have a strategic vision and be clear on what the ambitious strategy will do for us, we also have to be really clear about getting some of the fundamentals right. So essentially making sure that our annual reviews and our educational healthcare plans are of a good quality and completed within timescales, and that we are addressing some issues in relation to reducing the waiting times for children and young people for autism assessments. So in terms of the SEND inspection, I think you'll all be familiar that we had a SEND inspection in July last year, and the findings were published in October. And whilst inspectors found a range of good practice, particularly in relation to our joint commissioning, our work with partners, and that we knew ourselves really well, they highlighted significant areas of weakness, which resulted in the 3 recommendations that you see in front of you. So we have to address the poor quality of education healthcare plans and annual reviews, particularly as young people prepare for adulthood. We have to address our lack of partnership work and co-production with our children, young people, parents and carers. And we have to address the unacceptable waiting times for an autism assessment and the support that families receive whilst waiting. But we are not starting from ground zero. So this is not a position of starting from scratch. There's been a number of actions that have already been taken over the last 18 months, and those are summarised on the slide in front of you. All of those are connected to the 5 priorities within the SEND strategy. I won't go through these in detail, but if I choose one as an example, within priority 5, in terms of preparing young people for transition to adulthood, we insourced the travel buddy service. So we brought that service in-house to make sure that we could have greater influence on ensuring that it was a very good service and delivered to a good standard, with the key focus of making sure that we're supporting young people to become independent travellers to their place of learning and support that transition to adulthood as an example. And in terms of how we informed the written statement of action, we made sure that it aligned with a number of strategies that you'll see on the screen in front of you, but we also adopted the same approach as we did with the SEND strategy. So we used all of the feedback that we had heard to make sure that none of that was lost. And then we extended that further and held 6 workshops across the month of November. Those workshops were very aligned to the 3 recommendations, and they were co-designed and co-delivered with representatives from the Parent Carer Forum. We also took our thinking to a range of governance groups, and we very much, and you can see a list of all the different boards that we went to in terms of, are these the right priorities? Is our thinking the right? Is there anything that you want to change about that? And that was very comprehensive and very well received and valued. Although the inspection didn't highlight as an area for improvement in terms of engaging with children and young people, we really feel that that's an area of development for us. That's something that we are very much going to prioritise going forward. So what you see in front of you is a summary of the written statement of action. So this is essentially our plan on a page, and we will be uploading that to our local offer alongside the full version, because the full version, it covers across almost 30 pages. You can see here that we've got the recommendation on the left-hand side, what we have already done and what we intend to do. We're going to have a dedicated section on our local offer titled the SEND Transformation Programme, and we'll have things such as our Ofsted report, our written statement of action, any highlight reports. We'll have this summary plan on a page, any consultations that we're doing, any learning reviews. We're also looking to publish the agendas from our SEND executive with a summary of the discussion that took place. And we will also make sure that that section of the local offer includes reports that go to any formal governance groups such as scrutiny and so forth. So these are the key performance indicators that we will evidence and measure the impact that we expect to see as a result of delivering both the SEND strategy and the written statement of action. And you'll see that it's a mixture of hard and soft outcomes. So as an example, being very ambitious, but rightly so, that we will have 80% of education healthcare plans and annual reviews completed within their timescales by December this year. Another hard target for us is that we will reduce our autism waiting times for 5 to 18-year-olds from an average of 85 weeks to 40 weeks on average, 52 weeks max by April 23. And then we have some softer outcomes. So being very much focused on how do we know that our parents and carers and our children and young people feel part of this systemic change in our improvement programme and influencing the shaping and delivering of services. And we'll test that through a range of mechanisms. So quality assurance processes, we're going to have a youth participation worker supporting a children and young people's youth forum. We'll also be working closely with our parent carer forum, and we'll be doing some national and local surveys. So in terms of the governance arrangements, the SEND executive are accountable for the strategy and the written statement of action, and they have endorsed these. There'll be a quarterly highlight report, which will go to the SEND executive, and we'll also take a version of that to our Start Well board. We have 4 subgroups that sit under the SEND executive that will be there to drive improvement, and they're highlighted on the screen for you. And each of those have 2 representatives from our parent carer forum on those to ensure that we've got parent voice at the heart of our work. We'll be having a standalone children and young people's forum, as I said, and that'll be very much influencing operational delivery and in time strategic delivery. We also have our fantastic parent carer forum. I think I heard last week there's in excess of 60 members on the forum now, which is great to hear. And we'll be working very closely with them to drive forward this work. However, I do want to point out it will not be the only way that we'll be engaging with children, young people's parents and carers. This will just be one of the ways that we will do that. So in terms of where we are now, the strategy will be published in March after it's been to children, young people's scrutiny. Our written statement of action was submitted to Ofsted and CQC on the 11th of January, and we should know within 10 working days. So today being the day that we should have received feedback. Once that's been approved, we will publish it on our local offer. And that brings me to the end of the presentation. So just if there's any questions.
Thanks, Jackie. I thought, I wonder whether or not at the community board, there are some questions around the parent forum, parent carer forum, weren't there? I wonder, as we've got Jeffrey here, if he could, don't know, Jeffrey, if you're able to just talk to us a little bit about the forum and how it's functioning. I think there are just some questions or concerns about families who are being engaged and the range of families being engaged and those who are already engaged in that process. I wonder if you might share just some observations.
Thank you, Chair. Thanks, Jackie, for that great presentation, by the way. I think very broadly, the Parents Carer Forum is now functioning really well. I think we started off with around under 10 members. It really didn't get going for all sorts of other reasons until about October-ish or thereabout. And since then, we are now on to close to 60 members, just under there. There is a steering group now and a chair and a vice chair also in place. So that's really something we've been waiting for. Now the steering group are now meeting to kind of plan how it goes forward. There is strong ambition to make sure it's inclusive and diverse and not just about diversity as we know it, but also the different range of special needs and disabilities as well, not just autism, for example, and others in. And also the age range, the early setting years, the school years as well, where they are in school as well. And they're developing an engagement plan at the moment that will ensure some kind of campaign, really, to go out to different parents group, to different schools, governing bodies and so forth, to try and set out how people can join. Because at the moment, people have just kind of found out and come, but we are now moving into a more proactive stage to do that. So we anticipate in the next couple of months that this can it'll be really strong and diverse, which is I think where we all want to get to. Chair, I don't know if there was any specific, but that's kind of roughly where we think we are on the journey in that journey, and really getting the parents who are quite committed now running it, and we're just supporting them.
Thanks, Jeffrey. That's just really helpful. It's just useful to hear from you directly, I think, on that front. Thank you. I have Peter and then Rachel need to come in.
Yeah, it's just interesting, isn't it, seeing the data again. I mean, it's really good to see the wait time coming down 70 to 52 weeks. But 52 weeks is still really unacceptable, isn't it? 52 weeks, it's a year of a child's life waiting to be seen and be assessed for a diagnosis. And I'm sure I know some of the reasons underpinning it, the lack of staff able to do assessments and to make the diagnosis. It's just really just a bit shocking again, just to see that figure of 52 weeks. Anyway.
Yeah, completely agree, Peter. Rachel.
So I can pick up on that, Peter, because I think you're right, and it was something we were very conscious of going into the SEND inspection. It was something that came out very much from parent-carer feedback, and in response, I'm really pleased that we have been able to make a commitment to go from where we are now, where some people, particularly our slightly older children, our 11+ children, are waiting up to well over that 52 weeks, up to 94 weeks for their assessment. And we haven't had sufficient capacity to meet the demand. But there will now be some recurrent investment that will go in, which will, that recurrent investment is really, really important, because if we just don't have capacity to meet the demand, we just need to be able to kind of expand those services. So now the commitment that we've put into the written statement of action is that 52 weeks will be a maximum wait for 0 to 18s, and that actually for our 5 to 18-year-olds, we're looking to an average of a 40-week wait. And I think when I was speaking to some of the parents in the workshops that we had, it was really interesting that what they said over and over again was that it wasn't the waiting, it was the knowing where they were in the system, what they could expect. It was the support and the communication. And so that's another area that is coming across, and we are doing a lot to try to work with SENDIAS and with our providers to just make sure that people know what to expect and are getting support whilst they're waiting, and that they don't have that sort of blank sense of not knowing what's coming next. So, I'm pleased you've pointed it out, and it is a real issue, but it is something that I think we've got some really ambitious plans around, and that we are putting some investment into. I had a slightly separate point. Is it okay if I make that, Councillor Desves?
Yeah, of course.
Which was just, I mean, again, I'm sorry it's a bit doom and gloom, but I really appreciate the strategy. I think it's really good. I've been very involved in it. I do just want to make people aware that we talk a lot about the autism process and our capacity for autism assessments, but the range of other community services that reach into schools and support children with special educational needs, both in mainstream schools and in special schools, are under considerable strain in Haringey. Charlotte and I were meeting and talking to Whittington health leads about it, as we do on a regular basis. And so things like dietetics, speech and language and occupational therapy, physiotherapy, school nursing services. So I think I just want to make sure that we recognise that a commitment to see more local children within local schools is a very good ambition, but though our children's community services in particular are under considerable strain. There's a lot of work that's going on around both medium and long-term plans. There's quite a lot of short-term planning, but we don't have all the answers to it. There is an absolute shortage of staff, and those staff are working at capacity. So I just wanted to make people aware that it's not purely the autism assessment pathway that is under strain. It is a range of community health services as well.
Thanks, Rachel. And I think a lot of councillors will have experienced that, those issues and questions and had them raised. It sounds like an important question for our own local partnership, really, and system. I'm going to bring Anne and Zena and then Mike in.
Thank you, Councillor Dasneves, and thank you, Rachel. You've covered a lot of the areas that I wanted to raise. And Peter, thank you very much for raising this. We, through the work that we've done together as a partnership on SEND, and it's been some time now, have, asked ourselves this question quite a lot, and it's something we want to continue to focus on through the production of the written statement of action. I am grateful, Rachel, to you and health colleagues that the where we started is much reduced. However, there is still work to do. The point I want to make is that it isn't just, as Rachel says, about autism wait times. It is about speech and language and other therapies. And the impact of that on our children and young people, we do see through the system. We know that if children have to wait a year for speech and language therapy, that can impact them for many years to come. And I certainly know that when we get to Jackie's service, the youth offending service, where children are in the criminal justice system, we then have to have in that team specialists for speech and language, for example, because children have somehow been missed in the system. I mean, that's not the outcome that we have as our ambition for children and young people. I do also want to just underline the point that if you are a 5-year-old and you're waiting a year, then that's a fifth of your life. For a 50-year-old, you're waiting 10 years. I just want to emphasize it for impact. And none of us would want to wait 10 years, and we're asking that of young ones. So just the other point I wanted to make was about the capacity. We know that, and Rachel has told me, if she's told me once, she's told me 100 times. It isn't just about funding, it's about finding skilled people to do this work. I'm further concerned about mandation and that we're going to lose staff in the health service, even in places where we can scarce afford to do so. So I think it's right that we, as a board, focus on this and maybe think of ways to bring this item and this challenge that we have to achieve the vision for a better start in life back to this board. Thank you.
Many thanks, Anne. And you've preempted me. I was going to suggest that we think about bringing this issue back, and there might be other community services we want to bring into that conversation as well. Excuse me, Zena.
I think I want to say something as cabinet member for children and early years and families, and because SEND can corroborate has been at the top of our political priority list certainly since I took the cabinet lead in May, and I suspect it's been top of Anne's list I know it has for a lot longer. And despite the doom and gloom, I do think we need to recognise enormous amount of progress has been made by the new team, by the work with the CCG. And personally, I think that the Ofsted inspection was very welcome, and I think that their judgment was extremely fair. I cannot underestimate the people who may not be as immersed in it as perhaps some of us here are, the effort and the enormous amount of work that has gone in to trying to turn around this particular service. It is not that we haven't known some of the issues. There is some view being put out in the community that the inspection was somehow a disaster. It wasn't.
There was it was a very fair inspection, and it was a very accurate inspection, and recognised the issues which are top of our list and which we knew. And I think there has been enormous progress, particularly regarding working with parents and carers. Anyone who has any experience of special needs will know this is a really difficult, a minefield of rules, regulations, rights, responsibilities, but also of emotion and trauma. So working with families is really hard. And even if we weren't in a pandemic, even if we hadn't had Brexit, even if we hadn't had 10 years of austerity, not everybody would get everything they wanted when they wanted it, because we don't think the systems haven't allowed for that. So we are in a very good, it is a million times, it's better, much better over the last 3 months than it was 3 months ago. There's the written statement of action has actions which have already been acted upon, if I could put it like that. I think the work with health and the CCG coming forward with more money for autism assessment is long overdue. We're doing a parallel review of early years, and there is no doubt that inclusion of children with needs not necessarily identified or late, which have been completely diagnosed, but which everybody knows children need intervention, means that children with those sorts of needs will be in the early years centres as soon as possible, getting some of the early intervention which they absolutely need to have. And so there's 1,000 things to do, and we just have to keep moving it forward, and we have to campaign with government for more resources, more money, and the good news is we do have some more money which has come into the high needs block. So that is very welcome, and that will come in from April. That doesn't mean we're going to solve the backlog. It just means there's more money, which we might break even 1 year instead of being £23 million in the hole. So I'm sorry if that's a bit rambling, but I do think it's important to say that we are working with people, and the relationship with the Parent Carer Forum has really improved. The fact that people are involved in the meetings, in the decision-making meetings, in the Senate executive, in the subgroups, and being seen as no secret garden, because if this person is outside, they think there's some sort of secret thing going on. So the fact that the chair of the Parent Care Forum is a member of the Senate executive, I think, is a really important leap forward and should have happened a long time ago. And sharing the paperwork, involving people is obviously important and a sensible and modern and transparent thing to do. So that's our direction of travel. We're going to continue in building up the improvement, improving the plans. We've insourced the writing of the plans. I don't know, Anne, I could go on, but Anne, correct me tell me if I've missed anything key out.
No, Councillor Brabson, everything's been covered. Thank you.
A plan of moving forward with families, not doing things to them and not behind their backs. There isn't any way you can deliver an SEND if you do it without parental involvement. No way at all. Thank you.
Thanks, Sina. Mike, and then I think we'll have to move on to the next item.
Well, it's. I think it's just coming from Zina's point about being on the sort of outside, and I'm certainly from the outside, and actually, so looking at it from those concerns, I think people's concerns are related to the pace of change, and you sort of highlighted the fact that there has been, it's going to come on leaps and bounds, and I think that one of my questions is that recognised among the members of the Parent Carer Forum, for starters? So is that pace of change? Talking about not that there's change, but that there is pace of change, and that it's at a rate that they would be satisfied with. And then next to that, you mentioned that there's not that capacity issue, and Rachel, and that obviously it's not simply capacity, but also finding that skill. But in terms of capacity, obviously there has been a budget proposed which will see growth in and investment in the service, well, into children's and adults. I'm just wondering whether from where we sit now, there's a direct, you know, where there will be direct benefits from that in this particular area of the service.
Thank you. Thanks, Mike. And does someone want to come in on that while I just have a look? There's a couple of bits in the chat and I'll share them.
Jackie, would you like to come in on the bits about funding? Thank you.
Absolutely, yeah. So on the 2 points really, in terms of is the pace of change recognised by the Parent Carer Forum? We're in a really fortunate position that the steering group are really committed to moving this agenda forward. And I've had several meetings and several correspondence with the chair, the vice chair, and other members where they have told me on a number of occasions that they're really pleased and feel that they are engaged in this agenda and that they're happy with the pace that we're making. And we're very much in a co-production stage, so they are equally, influencing service delivery. So, I think it's something we constantly need to revisit. People have been waiting for change for a long, long time, but the change that's been made in the last 6 months alone is greater than the change that's been made in the last 2 years in relation to Parent Carer Forum work. So I think that's progressing really well. In terms of the funding, so with the growth that has gone into children's, approximately £800,000 is being supporting children with SEND. So that's funding within our disabled children's team, funding within the SEND service in particular in relation to increasing educational psychology resources, quality assurance and EHC case officers. And then we've also secured some funding. Some of that funding will be used to support specifically brokerage and quality assurance for the SEND service. So in terms of making sure that we are sourcing appropriate value for money and good quality placements for children, educational placements for children with SEND.
Thanks, Jackie. And there's a couple of comments on the chat, but I'm conscious Charlotte wanted to come in a while ago, so let me bring Charlotte in.
Thank you. Only if there's time. I just wanted to sort of a bit in relation to Anne's point in the chat around the 3 written statement of action areas. Remembering the third one was preparing for adulthood, which I think is really important that we reflect on at this board, because actually what happens in the early years and through the developmental cycle will influence adults we're seeing through the Health and Wellbeing Board. So that's sort of system point there. The second was on workforce, where I really do think through the Health and Wellbeing Board seminars, we're beginning to address this, but I just think there's a much more systems approach we need. It's lovely that Francis is here to think about the next step. I really think from a workforce, we've talked about some of the challenges of sourcing therapists or health visitors over a number of years. So how do we really sort of move that conversation on in a different way that hopefully meets our local needs around skills development, getting people into work who might not otherwise, and all those sorts of areas. And then the third is the resources point, where I just think we need that sense that funding is coming into every week we can get funding in, so being really creative around that. But yeah, really good to see the joint work, and I agree with Councillor Brabazon that the inspection was actually really helpful in articulating some of the things we need to do together differently. Thanks.
Thank you. Thanks, Charlotte. Now, Lynette put a point in the chat just about whether or not we have the capacity to deliver the support that we need and the improvements that we need to see. Jackie, do you want to come in on that, or Rachel, or both of you?
So I think Lynette, that's in relation to autism assessments. So I'll hand over to Rachel.
I've been writing a very long answer in the chat. Hang on, I will just say it. So it's a really good question. We're not just starting it now. So for probably about 6 months, the teams that provide the autism assessments have been doing a big mix of things. So they've been bringing in additional people to provide assessments, and the hospitals have been looking across the board at whether they can help each other. So, for example, BEH has been providing assessments for some of the children who are already known to their services, which is really helpful. So there is quite a lot that's happening in the short term. We're also making more use of online assessments. So there is a lot that's happening to reduce our backlog. And I think what I'm really sort of grateful to the wider CCG for supporting us with in Haringey is that in addition, where we have got insufficient kind of capacity to meet our demand ongoing, it's not just about reducing the backlog quickly, it's also about redressing that imbalance on an ongoing basis. And we have now got some more resource that is going into our autism assessment capacity overall. So we're going to have to work hard with providers about how we organise ourselves to do that most efficiently, but we will have some additional capacity in Haringey that should allow us to come closer to our demand. I'm a bit reluctant to say to meet our demand, because actually what you find is we're getting more and more people being identified earlier. So this is a growing population, but it will certainly help us with the mismatch between our current demand and capacity. And then there is a lot of work I think that we need to do, and that Charlotte and I and Jackie and others are talking about a lot, which is not just fixating on getting people to the point of assessment and diagnosis. You know what we're going to say, and it's all of that other bit is just so enormously important, and that's also kind of happening in parallel.
Sorry, just before we carry on, Chair, can I just ask people to refrain from using the chat, as it is a public meeting?
Thank you, everyone. Some really good points and a really good conversation and discussion there. I think it's important to come back to the questions of those additional services that sit around, like speech and language. I think we probably ought to come back to transitions at some point on this group as well, have a bit more of a conversation about that. And I know Barbara and I have been talking about that quite a lot, so that's on our agenda. I wonder if when we have an update perhaps on how we're going with the same strategy, we might invite someone from the carer forum, or indeed more than one person, to come and talk to us or share their experience. I think that might be useful and interesting part of the journey for us as well. But I'm going to move on swiftly and say thanks to everyone on that topic, and thanks, Jackie, for joining us and presenting that. So we're moving on to our next item, the integrated care system. And Rachel, well, I think you're going to introduce this, but we've also got Frances here, and we're really grateful that she's been able to join us too.
Yeah, Rachel, do you want to kick off and introduce your colleagues from the CCG who are going to take us through some of the headlines around the integrated care system development? We'll come in on some of the more local issues later. Yeah, fine, absolutely. So I'm going to just hand over to Frances. It's great because we had wanted to get a bit of an update on the development of the ICS and the Integrated Care Board as part of that, and the implications of some of the delays in that transition process. And so it's really nice that that has coincided with Frances being able to attend our Health and Wellbeing Board. And so she's definitely the best placed to talk us through that a little bit. So over to Frances.
Thanks, Rachel. And hi, everybody. It's really nice to see you. I know some of you, but not all of you. I'm Frances O'Callaghan. I'm the CEO designate for the ICS. Just before I get into some of the detail here, I just would like to extend my huge thank you to everybody who has worked over Christmas in terms of the Omicron wave, and to everybody who's been involved in the vaccine programme. It was just really good to hear what was said earlier about the progress that's been made, and I know from my early involvement how much of a multi-agency arrangement it's been. So thank you, and it's nice to see you all. So I'll be brief. I know you want to talk about some of the borough partnership developments, but I'll just give you a very high level overview of where we are and my intentions around moving forward. So as I'm sure you know, the health bill is moving through Parliament. The date has been delayed for the statutory formation of the ICS from the 1st of April to provisionally the 1st of July, subject to the movement of that bill through Parliament. In some ways, that's disappointing, probably not surprising given activity around Omicron over Christmas, but also I think it does just give us a little bit more headspace in terms of organising ourselves as best we can as we go into this change. I do think I've only been in NCL for the last 2 years, so I can only talk about the last 2 years, but I do think that the last 2 years in terms of the COVID response has given us a really strong foundation to build our integrated care system on. The vaccine response was one example of that, but throughout my time in NCL, I've been very impressed by the level of partnership working, and I know Zena Etheridge isn't here, but I would like to put on record my formal thanks to her as she departs from Haringey for all the help and support and local authority input she's given into the developing ICS. I know that you will miss her, and we certainly will as well. So the basics of the ICS are, I'm sure, well known, so I won't dwell on them. But as you know, we have to create an integrated care board. Mike Cook is the chair designate for that board. We will also create formally an integrated care partnership forum, which I would like to talk about in a little bit more detail. And Mike has also created the community partnership forum, not as part of the legislation, but I think as another way into trying to fully engage with our communities as we move forward. So one of my main tasks at the moment is creating the leadership team for the integrated care board, and I won't sort of dwell on some of the mechanics of the governance around that, but important obviously that we have fair and transparent process in terms of changes to the CCG. Non-executive appointments will also be made for the ICB, and there will be local authority, primary care and provider representation on that board as well. The integrated care partnership is sometimes referred to as the ICP, not to be confused with PLACE, but the integrated care partnership will work alongside the integrated care board to set the strategy, with the ICB having the responsibility of delivering the strategy. The ICP, the integrated care partnership arrangement, will be much more broadly representative, particularly around elected members, and having wider input onto that ICP. You may know that there is a very live discussion about the role of elected members onto the actual ICB, which I won't comment on at the moment because it's one of the topics being very discussed very much as part of the legislation, but whichever way it lands, there will be local authority representation on the ICB. I think within that, we want to be really, really clear that we build the right focus on place. We know that not all places, not all boroughs, not all neighbourhoods are the same, and the work again that we've done on the vaccination has really allowed us to use our population health data in terms of meeting the needs of service users, and we need to be able to roll out that approach and philosophy in terms of how we move forward. There is a white paper due to be published in the next 2 to 3 weeks on the integration at place level. And again, without preempting that, we broadly welcome it because we expect it to be permissive in terms of understanding local arrangements and delegating power into local partnerships within the accountability of the ICB. We're placing significant emphasis on clinical and professional leadership in the ICB. The CCG has been a clinically led body, and we will be very careful not to lose that clinical and professional leadership as we go into the new arrangement. There will be a formal medical and a formal nursing appointment onto the board, but I'm also very clear that via our engagement with the local authorities, we recognise the importance of the public health work, and we are clear that we have a very strong public health voice at the right levels. The same is true for the local authority CEOs, the DASs and the Directors of Children's Services. We're very keen that we formalise some of those arrangements, recognising that whilst you can't speak and make decisions for each other, you can bring a collective voice to the table. The development of the borough partnerships is really important to us. Things do not happen in the ICB office, things happen out in the place, out in the community. So we've got to be really, really clear that we're not seeking to centralise things, but that we're continuing to work on the principles of subsidiarity and working through what delegation may mean as we move forward. I do think that the work of the Population Health Committee is going to be really very important in terms of understanding our priorities. We know that traditionally, particularly with the advent of payment by results, we continue to spend lots and lots of money in hospitals, and I'm not saying that money spent in hospitals is not money well spent, but we do believe that we have an imbalance in terms of addressing inequalities and the wider determinants of health. The work that the public health team did recently that we saw showed really the impact of housing, for example, on people's health and well-being, and we know obviously that that's a concern of the local authority, and we see ourselves as working very much in partnership with you and the expertise that you have around the wider determinants of health. I just want to reflect finally on the role of the voluntary sector. It's nice to see Jeffrey here. Jeffrey's been very much part of the mental health reviews and the work that we've been doing on community services. So really important to see our partners round the table. And I know that Sharon is here from Health Watch as well. And we continue to encourage and support those voices coming into the ICS. I'm going to stop there. I'm very happy to take any questions or hand back to Rachel. Thank you.
Thank you. Rachel and Will, do you have anything to add before we move to questions and discussion?
So I think I was going to touch a bit on the Borough Partnership, and I think Will was going to talk more from a population and health outcomes perspective. So it's probably worth taking questions before we go on to those slightly different angles on it.
Okay, thank you. I've got just a couple of little areas that I wanted to raise, and I'd be interested to hear your views on, Francis. I wonder whether or not you've had a chance yet, and I know you'll have a lot on your plate, to consider your sort of vision for oversight. And I know that for oversight of the ICB and the strategy that it will set by oversight by the community. And I know that in other fora there's been a lot of conversation about the ability to flex and to have that local flavour, I suppose is how I'd put it. We've had a lot of conversations about how people participate in the decisions that we make health-wise locally, and how we listen and learn from the things that are taking place in the communities, the strengths that we have and the challenges, and how we then create strategies that are very much led by that and led by those both concerns but also those observations and strengths that are in the community. So really interested in your comment on that. And the other thing, and it's a little bit, it's from the broad to the very specific. I was at the Haringey Over 50s Forum yesterday, and the two very strong areas that came out from that conversation, and they were, you can imagine it was very wide and very broad, that were health related, were access to primary care. And of course, we had a session at the last Health and Wellbeing Board about primary care, but that continues to be in a lot of concerns around that. So it would be remiss of me not to say that, well, I had you here and to just have some observations for you on that issue, and also mental health and wellbeing. And again, we've got some really good partnership work in the borough on that in that area. But again, just raising that visibility. It really felt, we've talked a lot about the visibility of health and mental health and wellbeing post-pandemic, but I feel it in all the fora that I go to, and a lot of people, it's really positive that a lot of people want to talk about that. But then also, of course, what they're concerned around is the adequacy of all the right services in the right place and the right partnersps. So that's just a few things from me, and I think we'll go to some other questions.
Thank you. So lots in there. Thank you. So firstly, in terms of creating strategies that are effective and mean something to the local population, I think we are fully committed to this. Our strategies are only as good as our ability to make the changes that are described in them. And certainly now, post-Christmas, post-Omicron, it is our intention to come out and sort of re-engage in terms of developing the strategy for the ICP and the ICB. That's the first thing. The second thing is I firmly believe that any proposals we come up with will be better if they are informed by the local view, local authorities and other stakeholders. So there is no doubt in my mind of the importance of that. We do, however, need to learn to do things a little bit differently in the NHS. And so I go back to what we learned from our local authority colleagues, our voluntary sector colleagues, our faith leaders, particularly through the vaccine programme, that some of our ideas in the NHS about how we best delivered services did not meet the needs of the local population, just because they weren't in the right place or people couldn't understand what we were trying to do, how to access them. So I'm really keen that we really take that as an example of us being able to work together to make services and delivery of those services more meaningful to the people we're seeking to deliver them to, and especially because we're talking about early intervention, we're talking about work in the community. Once people get into hospital, yes, okay, we know what to do with them, but actually we do need to work much more closely with you via our primary care teams as well, to really ensure we're doing the right things. So we will be coming to you and asking for help. With regard to primary care, I think I do want to absolutely acknowledge and pay tribute to this stupendous work that the primary care teams have been doing. We're seeing significant rises in demands on primary care in terms of the number of appointments available. It's at least a 10% increase from this time 2 years ago. We have got the Winter Access Fund in terms of putting more money into primary care to increase opening hours, to provide more support to patients, particularly around the appropriateness of using online consultation, but recognising the absolute importance of maintaining face-to-face contact where that's required. And thank you again to our Health Watch colleagues who have been so helpful in helping us to do that. It may be better if I ask Peter or Sarah McDonald-Davis to comment further on primary care, but I think you can't have integration without primary care being at the table, being very much part of the solution. And I think that we certainly believe that whilst in the CCG we're losing some of that clinical leadership at the top table, we want to ensure that we safeguard against any wider change that would result in a diminution of the primary care voice. So I think there's the practical day-to-day aspects of the delivery of primary care, as well as their contribution to the longer term strategy. And I've forgotten the third part of your question, I'm sorry.
Mental health.
Oh, mental health, thank you. So as you know, the mental health review is underway, looking at how we are spending our mental health money across the 5 boroughs, and we do see some differences in that, although not as acute as some of the differences we see in the provision of community services. So I think that we are getting to a good place in terms of the core offer for mental health and how people access that. We know that the mental health investment standard money will be protected going forward, but we also know that we've got some quite difficult conversations ahead in terms of the right balance of community, hospital and mental health spend. I think also just to touch on the wellbeing work that people are doing with regard to the staff. This has been a really big part of our COVID recovery in terms of ensuring staff don't burn out, ensuring that we're supporting staff and ensuring that they still want to come and work in the NHS where it's not getting any easier. So looking after our own staff as well as looking after our residents. Obviously, many of our staff live in NCL is a very big part of what we're doing. So I'll stop there, but recognise that Peter or Sarah may want to come in on any of those points before we take further questions. Thank you.
Thank you. Thanks. I'll bring Peter in and bring in questions from Anne and Jeffrey.
Well, I'll go on to the primary care and away from what I was going to say to Francis generally, but I mean, just on primary care, let's be honest about primary care was in difficulties before the pandemic in terms of access. This isn't something that suddenly sprung up because of the pandemic. There was a long-term issue with primary care in terms of investment, in terms of the workforce, in terms of the workplaces. The pandemic has highlighted that. I think this is my personal view, is that primary care is entering into a very difficult time at the moment. Jeremy Hunt is leading a committee in Parliament to look at the future of general practice, and I think whatever that committee pronounces on will have a big long-term effect. We have an issue in Haringey, of course, with many GPs being over the age of 55 who will be gone over the next 5 to 10 years. And we have an issue around attracting young GPs to come to live and stay in Haringey. It's a big problem, really, but it's also part of a wider context that Frances has touched on. And Frances, of course, has touched on one of my favourite themes that she knows very well, and that's about, you know, the community services, funding. And Frances, you're in Haringey, where Wood Green, we are got plans to open a diagnostic hub, which I think is going to be fantastic. And this, to me, is music to my heart, because instead of everything being hospital concentric, you know, then I hope this will be more community concentric, you know, because people on the whole don't want to schlep down to hospital. And if they can go closer to get their diagnostics done, and if we can link it all up digitally, then I think we might have a future where healthcare is delivered in a different way. And of course, the ICB has got to address this, hasn't it, about how we offer healthcare in a different way, because Frances and I both know that we've been living in the era of funny money during the pandemic, but the real money question will now come home to roost in the next year or two, when we have to make some sort of financial sense of the services we are able to offer within the confines of our financial envelope. And that's going to be quite difficult, really. And of course, the ICB, Frances, is going to have its work cut out, isn't it? Because if we really are going to address health inequalities, then invariably you will step on some toes in terms of doing that. You will step on some toes of very strong vested interests in the way that healthcare is structured. And that's not going to be easy. So I rather anticipate that you'll have some stormy times ahead and probably some difficult questions to resolve. Anyway, but I wish you power to your heart, Frances, just to cheer you up. It'll be fine. Thank you.
Thank you. I think it's really important, especially in the noting that there were issues before, and I think you're right. Many of us were well aware of it. I think for me, the reason I raise it and will always continue to raise it is because we have this, you'll all know, we have this agenda about early intervention. I'm you know, passionate about the fact that I think there are some people in our borough who maybe only interact with a GP or maybe only interact with a school, and those are their only sort of interactions. And those are those vital opportunities to navigate and find what other services choose. And so making sure that that works well, I think is fundamentally important. I think I'm saying things you all know, right? But also I'd say the other thing we often talk about here is why people come to it. Why are people in A&E? Why are they in A&E? The dichotomy, you know. So, you know, whilst I travel around the borough and people say to me, I can't get in to see my GP, and someone told me I should have a phone consultation, but I've got an ear problem, so I can't hear well, so that's not going to work. So those are the kinds of things I hear on one hand. On the other hand, we were talking about, and have got some really good interventions, I think, for instance, at North Mid, having GPs there at A&E, those two things going on at the same time. Anyhow, Anne, you wanted to come in.
Frances, it's really lovely to have you here, to have this opportunity to hear from you. And I think that certainly what I'm hearing is enthusiasm for the changes that are to come. Frances, I've got a number of points, and my first one is about changing the outcomes for people in the community, and the differential funding that we see across NCL. And I'd like your thoughts on how that's going to, how we're going to achieve that, because, you know, we talk about levelling up, not levelling down, and I connect that to Peter's point. I don't know this area very well, but certainly while I've been in Haringey, what I've heard is that the per capita ratio of GPs, or per capita GPs, in the more deprived parts of Haringey, Tottenham, Northumberland Park, that is lower than more affluent parts and across the NCL. And then in my head, I link that. So therefore, one of my questions is, how can we resolve that? And then I link that to early intervention. If there were more GPs that people could walk to, say in Northumberland Park, Tottenham, where people could form local relationships, would that impact the local people's ability to ask for help earlier, because they can form relationships with their local smaller GP, rather than not be heard in a bigger surgery and that escalate into an episode? I say that from experience that I was in. I happened to be in a Tottenham health centre, and I saw somebody who came in and was and had missed his appointment. I was just observing. He'd missed his appointment on the phone and came in, was anxious to speak to a health professional. And what he got from a really well-meaning receptionist is, wait your turn. And it reminded me, as I sat there, when I was, you know, used to visit the GP more, I would know who they were and they would know who I was. So I wonder, is that actually, and if we invested more, will that help the community? I know that I've said a lot there, and I say the same for dentists too. I don't know if it's fact, but I heard in Northumberland Park there's one dentist. I don't know if that's true. Then we come back to speech and language for children and young people, and I'm going to make the same connections through. That was one point. The other was, and I'm sorry if I missed it, it's the relationship between this board, Health and Wellbeing Board, and ICB and ICP. That this is a statutory board, and that might change in July or in the next few weeks. We might get an indication of different, but the overlap, how are we going to resolve that? I'm really, really pleased that you talked about DCSSB having consideration of involvement in ICB, because in my experience, again, in health, that children sometimes doesn't get the loud enough voice. And so I would be really grateful if children had that big voice, because it's early investment. I always say invest in children, it's early investment. And then there's something about planning, and we had an interesting discussion at our Borough Partnership Place Board about a borough plan and plans and ownership, that it would be interesting for us to really be honest about that, so that we do form a plan that we all buy into. So a bit like Peter, there's a lot there.
Yes.
Thank you.
I'll come back on a couple of those, then others may help. So I'll do the easier bits first. There are no plans for the Health and Wellbeing Board not to be statutory. My expectation is that this will continue as a statutory board, and the local authority will maintain its statutory responsibilities around scrutiny, etc. So I could be wrong, but I'm not expecting that to change. So our challenge is, how do we fit the borough partnership and the delivery arrangements sort of next to the strategy that the Health and Wellbeing Board is charged with developing? And again, there won't be a one size fits all. Some of the boroughs may put the two meetings together, some may separate a sort of strategy from a delivery conversation, but I think there will be sufficient permissiveness for the boroughs to decide how best to do that. Your point about primary care is very well made, and in the context of inequalities around funding. So the work that we've done on community services does really show that there are clear discrepancies in funding, with Haringey, as I'm sure you know, having less money per head of population, particularly when compared to Islington. And that's interesting in terms of service delivery, because obviously the community services are provided through the same providers. So there are some questions to be asked there, now that we've moved away from the single CCGs in terms of how CCG money is spent. But I'm really pleased with the work that the community and mental health teams have done on the review, because they have really, I think, for the first time, exposed those inequalities in a manner that people can accept. That doesn't mean we've got all the answers, but there is a really strong willingness to accept that actually this is not acceptable. We can't preside over this difference and we have to do something about it. that's the difficult bit. It will take time, and in levelling up, we can't afford to level down. And it does go back to the point that Peter made earlier around, do we truly have parity of esteem in terms of physical and mental health? Are we really prepared to take some of those difficult decisions about moving money out of what was traditionally been hospital spend into some of the community and further downstream? The primary care question is a really good one, and as you know, without seeking to dodge it, we are only the delegated commissioner. The planning and the money is still held by NHS England, but we are seeing more delegation around dentistry and optometry, community pharmacy, and again, massive tribute to the pharmacists and the work that they've done in the vaccination programme, which has really shown that they can do more, they want to do more, and that potentially can release some of the burden on primary care. The truth is, Anne, and Peter will come in if he feels I'm speaking out of turn, is that primary care is really, really hard, and it's really hard at the moment, and it's really hard in Haringey, and it's hard in places where there is greater deprivation. So the limited number of GPs who are available are not flocking to the more difficult places to work. And so our challenge is to work with Health Education England to get more GPs, but it's also about creating different career routes for people who can support GPs, because we know that some of the GPs have better admin infrastructure, some of them have better digital infrastructure, and so the role of a GP is never the same wherever you go. So there is work to be done there, which I do think, despite not being the commissioner as such, we have a role to play, particularly when I talk about community pharmacy. I worry about dentistry as well in terms of access to dentistry, and that's something we've not been close to at all, but again is going to be delegated to us. So there's a huge amount in what you say, and sometimes when I feel overwhelmed by it, Peter Christian told me that I would never have a dull moment in NCL when I was applying for my job, and he was right. And in those moments when I do feel overwhelmed by it, I also think, but look at the good things that we've done, and we can't fix it all tomorrow, but I do believe that there is a commitment to change and a commitment to bringing care closer to residents, to addressing the wider determinants with you. And it is that we need to just keep going on. Some problems like the GP numbers feel more difficult. Oh, and I agree with you on children. Start well.
Thank you.
Thanks, Francis. Thanks. Those are really useful points. Peter, do you just want to come in quickly before I bring Jeffrey?
Well, just quickly, I'm so glad Francis mentioned dentistry, because we had the dentist at the clinical advisory group before this meeting, and it's worth pointing out that dentistry, like general practice, is also faced with a shed load of work that's been held back because of the pandemic. So they are struggling, like GPs, to be able to catch up, you know. And I think, again, I think the public sort of feel that everything's sort of back to normal in general practice and in dentistry, and it's not by any means. They are really catching up with 2-year backlog of work. And so I think we mustn't forget the dentists, and thank you for mentioning the pharmacists who've done great stuff with the vaccinations.
Really
brilliant.
good.
Yeah.
Thanks very much. Jeffrey.
Thank you, Chair. Good to see you, Francis.
Hello.
And thanks for that presentation as well. Everything I'm going to say is positive, so let's agree that. Then secondly, I think some of the discussion we are involved in looks really good, as we've expressed many times. So 2 things really I want to say. One is around this idea of subsidiarity, or trying to get some of the decision making, trying to get some of the local people, even grassroots organization, residents involved in that process. How do we achieve that? I think that needs some kind of thinking. I know the VCSE strategy is picking up on some of those things, and all the things there, by the way, are fantastic, as we've said. We just need to see how they get practically implemented and delivered. And I know there's also a resident engagement strategy that goes alongside that. So I think how we move from that NC level really to not just locality level, because now we are talking actually about neighborhoods level, certainly in Haringey. So how we achieve that and how we resource and allow that to take place in this kind of new model we're trying to create. And again, leveling up is something that has been said a lot. I'm going to bring it up in another perspective. That is, how do we level up with, for example, our community organization, our grassroots organization, and some of our residents? How do we get them more involved than they've been up to date? And lastly, the ultimate test is going to be, to what extent are we practical? To what extent are we proactive? And to what extent is it more than just being sick? It's about wellness and about all of that stuff that's really positive for people and people's experiences. So that's in a nutshell, I think what we want to try and achieve within this new structure. As I said, it's all positive.
Yes.
And can't wait to some extent. Thank you.
And thank you for the voice that you've brought into those discussions as well. It's been really helpful.
Thanks. Now I'm going to bring in Zena and then Sharon. And
Sharon could go first. Yeah, no, just to follow on from Jeffrey and to support what he's saying, to emphasise the importance, as we go into these new structures, of ensuring that the independent voice of patients and their experiences is allowed space to come throughout. We've all seen the various graphs as to what the decision making is supposed to be. It's not actually clear to me in all of them that there is room for that voice to come through. And going back to an important point that Peter made, I think, we probably are looking at completely new ways of delivering, particularly primary care and other services going forward. And in that, it's going to be really important that we are listening to people's experiences and their perceptions of care going forward. We've been involved in the consultations around the diagnostic centre in Wood Green, and obviously asking people what they think about it. And it's actually quite an alien concept, the idea that you go to the shopping centre to get your testing done, and that needs explaining to people, and people need to have confidence in a different way of working. So we need to make sure that we have our ears open, we have proper mechanisms for listening to people as they go through. And you probably expect me to say this, but it needs to be resourced to actually listen to people and to bring their views to the table, and a whole number of different tables, new tables that we're going to have. It doesn't come cheaply, and it does need to be resourced. If we think it's valuable, we need to pay for it.
Thank you. Thanks, Sharon. I think that's right. And actually, we've got Jonathan on the call, and I just wanted to credit Whittington Health with really listening to our questions about how we'll engage with people, for instance, on the new diagnostic centre. And I think that's been a real positive, even though it's been hard because the timeframe on that project has been challenging, and that's not anything that anyone has determined locally at all. But I think that's to everyone's credit, and is part of that journey and that learning, and we'll learn a lot through that about how we engage. And I think I just share some of the, I think even yesterday at the Haringey Over 50s Forum, there's real positive that we're trying different things, and people are pleased about that, and they're pleased that they've seen some possibilities and opportunities for engagement, even if it is speeding. So I just wanted to credit that, because I think and acknowledge that. I think I'm just going to, Councillor Carter's got to leave, but I think he wanted to say something before he left. He's got to go to another meeting.
I did just before I leave, and it was really actually just to echo what has been said in this room over this. And I think actually, it's I think your presentation, Francis, was very reassuring, even inspiring, actually, which is great, because I think there is a lot of anxiety out there about what the changes in the NHS and the incoming integrated care and what that can actually mean. And you've kind of described it as something very integrated. And I think you said the strategies are only as good as the changes they make, or something like that. And I think obviously in Haringey, the change that we need to address is the massive health inequalities. And I think we have found certainly in social care in Haringey, how much the patient and stakeholder input is, how important that is in being able to create this change and be able to have the real positive health benefits. So all I would say is just to echo a point that that Sharon just made, is it is about, you know, in that engagement of patients and public, and ensuring that the mechanisms for that engagement, because otherwise we're just talking about it. That would be my only, yeah.
Thank you.
That's it.
Thanks, Mike. Thank you. I'm really conscious of time, but I'm going to just bring Jonathan in briefly, and then Councillor Burton. I think Jonathan might want to respond to something that's been said. Okay, and then we must move on, I think.
I just wanted to take 2 seconds to echo a lot of what's been said and say I've just got a couple of slides here that I thought I might just quickly share to get people excited. And that is a couple of pictures of the Wood Green shopping city at the moment, with the hoarding of the CDC visible at the moment. So it's just really exciting, and I think just plays to what Francis has been saying about integrated care, but also that partnership across multiple providers. So we just happen to be the host of this, but we're absolutely not the be all and end all as Whittington Health. And you'll see there we've named every single organisation providing services within NCL down on that hoarding itself, because I think it's just really important that this is a system resource, and it is a system resource tackling inequalities in Haringey. So just wanted to echo that point.
Thanks, Jonathan. That was nice. That was everyone can bring pictures in future, please.
Can I thank you very much for your talk. I talk as someone completely ignorant about all these integrated healthcare systems and trying to get my head around it. So I apologise for my lack of grasp of some of this. But I was so it was interesting to hear what you said. And the area I want to ask you about is about mental health. Barnet, Enfield, Haringey mental health, and how all of that works, because I don't know whether anybody mental health is on health wellbeing board. No one's here today from Mental Health Trust. As a ward counsellor, I'm speaking as ward counsellor now, the most difficult casework that I get is around mental health and the impact of people who are mentally ill in the community, and how that can impact on other people, and how difficult it is to get things to move. It takes months and months. And that's one thing which really worries me, because the impact is all bounded by, you know, lots of rights and lots of issues about conflicting rights. Getting people to come out, see people, in the pandemic, that was absolutely, well, in the height of the pandemic, impossible, and causing the people who came to me massive stress and anxiety. So not just the mentally ill person, got the other party. So that's one issue. And the other is about how you're going, some of it is linked to housing provision and the role of the housing providers. Particularly, I know Beverly's going to know exactly what I'm going to say, is about the registered social landlords. I can't call them, you know, housing associations anymore, because they're more like private landlords than they used to be. But the issue in dealing with all of that and dealing with the complexities of this area of mental ill health is mind-numbing, is so difficult. And the stress and that it causes, and the ripple into loads of other areas, and the things that I'm thinking about affecting the police who are accused of all sorts of things by somebody who was who is, you know, living in the community, and they had to take a lot of allegations, the other individuals, and I would hope that this area of the integrated health system is going to be looking at that. And I suppose I'm putting in a plea that you start talking to these housing associations, because they are incredibly, as a councillor, I find them really difficult to talk to. How managing these mental health situations is like a minefield. And I would hope that we might, if we talk about early intervention and prevention, we might be able to say, look, stress, worry and money, if we can work with those sorts of organisations who accommodate people who they know are fragile.
I don't know if that makes any sense.
Yeah, and I think it's a really good example of where you can only solve the problem if you work multi-agency. You can't fix it, we can't fix it, primary care can't fix it. It has to be solved together. So I think that's really important. And I think the point you make about housing, whilst not within my gift to solve, it is something that we can address together, because we know that the impact of housing on people's well-being is really, really significant. It's a small point, but I think the work that we've done around the Inequalities Fund, which I know has looked at some interventions in mental health, and Rachel will have more detail than me, but the Inequalities Fund, we set up deliberately top slicing the money going into the acutes, because we wanted to spend more money out of hospital. It's a relatively small amount of money, but it has begun to shift that culture in terms of, or the perception that all our money is going into hospitals. And I know that there is a specific project about young men in Haringey, and it's a small example, but it is something we want to keep building on. So I would like to sort of reassure you that that's very, very much on our minds.
Could I just come back and say, perhaps at some point when you're more established, there could be some bridge and some communication with the big ones who operate in the Haringey. There are certain housing associations who are very, very big landlords in this borough. Sure. And I think would be a starting point for an open dialogue with them about when they house people, because they know what their tenants bring. I think
thank you.
I think there's and I think there's that golden thread generally, and Francis alluded to it, around housing and health. And there are mental well-being, mental health is a big one, but there are other issues too. Children with respiratory illness, housing in damp conditions, and all those things are not new. And you think you're right. So I'm also making some notes, because I think there might be some things future
good idea
to have here at Health Wellbeing More. Really conscious of time, so I want to move us into just Will and Rachel a little bit. Saying apologies. These discussions are always really good and varied, but we run out of time otherwise.
So what Councillor Desned, what I could do is almost kind of morph some of those questions and points that were coming up straight into the update on the borough partnership, because you're asking the questions that we are very much engaged within the borough partnership, and all I wanted to do was a really brief update. So we've got a couple of different strands of work, both of which really do feed into some of these questions, this kind of big question about how do we do this multi-agency kind of working, and for us particularly at borough level, at place level, and also what's happening in practice. So if I just talk about what we're doing on OD and our development as a borough partnership, and a couple of things that we're doing in practice. We have been having some health and wellbeing board seminars, people have been involved in them, and I think where we're getting to with those conversations is a real sense that we've got very strong foundations, we've got good working, we've got good leadership in Haringey, our architecture is there. Now we're getting into a real delineation of exactly this sort of issue about our strategic focus. So if we know that housing and well-being and employment and health are intrinsically interconnected, and we do, what does that mean for us as a borough partnership? Do we want to have, for example, a single overarching borough strategy? How all-encompassing then is that? And is that the focus of our borough partnership? Or are we more operationally focused, or do those two things work alongside each other? So we're asking ourselves and trying to, I think through the next few sessions and seminars, we'll try to answer some of those sorts of questions. Also things like governance. If we want to be really effective as a borough partnership in taking decisions, and it might be decisions about housing and regeneration that have an impact on health, how do we make our governance as a borough really effective? Because at the moment, sometimes, it can be, we have several fora that make these sorts of decisions. What level of responsibility are we prepared and wanting to take on in terms of decisions about resource allocation? And Francis was talking about, scope for those sorts of conversations about delegation. And as we move to taking those sorts of decisions on how do providers work most effectively together. So we've had, people have talked in individual conversations about things like lead providers. At what point might we be sort of ready to have those conversations about provider organisations? And then we're doing loads of practical work. And whilst a lot of it is small scale, actually in Haringey, our Inequalities Fund is not insignificant for us. So in May, we had an opportunity to bid for around £580,000 worth of investment. It's all over quite short term, but it is allowing us to do things like really think and work on mental health in the east of the borough. Tottenham Talks, particular focus on young people, on Black young men, and really good work across Haringey and Enfield on that. Then we also put together some funding applications around 850,000 in October, which again, all of that investment is going into the east of the borough, into a whole range of different interventions that really do get at universal speech and language services and lots around peer support, for people with mental health issues, lots around peer support for people with long-term conditions, lots around peer support and mentoring for families. So that it's really interesting, because not only is it an opportunity, but also we're learning by how we do that. So things like how we engage and do co-production around these initiatives are real food for thought. On a practical level, and I'm speaking really fast because we don't have much time, we've also been doing a lot of work around localities that Charlotte has also been hugely leading from a council point of view, to really get us to think about our neighbourhood infrastructure, our infrastructure as localities. And I think that people within the board would be really interested in that and in the work that we're doing to come towards having a neighbourhood level profile that really tells us who are the teams that are working in our neighbourhoods, the health needs, the estates opportunities. So there's a huge amount of work that is happening on all of these issues that we've been kind of grappling with within this meeting, that we're taking forward through our borough partnership. There we go.
Thank you. That was amazing, Rachel. Great. That was brilliant. Thank you. Really useful in the time we have. I'm glad you mentioned Tottenham Talking, because I met some people from that group and I felt like it was a really good example. We talked a lot about that, listening to what local people need, what that local flavour is, in the hope of having something that's much more effective rather than imposing some bigger grand idea about how we might reduce inequalities. So and how we might engage people in their own health and well-being. So really positive example, I think, there, certainly from what I heard from people working on it. Okay, thank you very much. And I know that Frances had to leave us, but I'd like to thank her anyway in her absence for joining us. And let's move swiftly on. Charlotte and Jeffrey, do you want to come in quickly on item 11?
Yeah, I mean, I recognise the time constraints. We can circulate. We can circulate our slide deck. I suppose I've just posted in the chat, and now's apologies for that, but Great Mental Health Day I was going to reference in the presentation, which is this Friday. Just wanted to mention that. And then I just wanted to reference a couple of other areas where there's funding come through to support our work on inequalities in line with the action plan. So Community Vaccine Champion funding we've had through from central government. We've managed to get Health Education England funding to support joint training, and Lynette is on the call, so I don't want to steal thunder, Lynette, but from Mind in Haringey, the local Met Police and BEH to support some joint training around working to support people with mental health needs in the community who are at risk of getting involved in criminal activity, and I guess just a number of other areas that are really importantly supporting this work on Inequalities Council. Babson earlier mentioned the early years review, for example, and just really want to highlight our work on Somali communities, with the first full Somali community network happening on the 24th of February after some really good engagement to get to this point. So we can put other things in, but just a flavour of the many things that are happening in this space. I see Will's got his hand up as well. So.
Thanks, that's really useful. And yes, we will circulate, and I also would encourage people to send any comments, questions. Will?
Yes, actually on the previous item, I wanted to give just a very quick update. This relates to North Central London, the developments with the NHS. There's a real focus on population health, which is really welcome. Directors of Public Health from across North Central London have been involved in the Population Health Committee, which is really focused on tackling inequalities, prevention, and looking at the wider determinants of health. And as part of that work, an outcomes framework is being developed across North Central London that will feed into the plans for the integrated care system. That's along the lines of start well, live well, age well, so aligned to the individual health and wellbeing strategies. And we're going to do some work in an upcoming health and wellbeing seminar, just making sure we're aligned in terms of those outcomes. But it's quite an important piece of work, so I just wanted to signal that in the board, and we will be coming to engage through a health and wellbeing board seminar.
Thanks, Will. That's really useful. Absolutely, and seems an important focus for us. Thanks, everyone. Beverly, I'm going to move swiftly on to item 12, and in a couple of sentences, you could just share it if that's okay.
Thanks very much, Councillor Desneves. So basically, this is the issue that arose at the Community Health and Care Advisory Board recently about ensuring the voices of people with disabilities are heard in all sort of traffic and parking issues. So following that discussion, I have met with the Assistant Director, Direct Services, Mark Stevens. He absolutely acknowledges the issues that I was able to share with him. He's absolutely made a commitment to work with our stakeholder groups that are already established, the Adults Partnership Board, Carers Forum, etc., SCORD, etc., etc. And we as officers will support him within that work, both on the exemptions work on the LTNs and the challenges with the digitalisation of parking. And we will come back to a subsequent Health and Wellbeing Board to give an update.
That's really brilliant, Beverly, and thank you. And myself, I know Councillor Carter's left, but I had a conversation with him and also with Councillor Chandwani. They were obviously well aware of the issues and of the concerns and very committed to the trajectory that you've described. So thank you very much. Thanks, everyone. I'm just going to list quickly a few things that I think we might want to pick up at future mental health just from today. I think mental health. And we talked about those services that sit around and wrap around people, like speech and language as well. So perhaps a session about that, transitions and preparing for adulthood, and maybe we want to talk about dentistry at some point in the future, at the right moment, I would suggest. And then I was going to wrap up and just say exactly what Charlotte said. We've got Great Mental Health Day on Friday, so it's a really great opportunity for us all to check in, but also check in with others. There's a range of activities going on, and thanks to all the partners, including Skin Haringey and Net. Thank you. Thanks everyone for joining us, and we'll see you all next time.
Thank you, everyone.
No, we did answer. Charlotte did answer. Charlotte.
Okay, that's it. Madam Chair?
Oh, you see, we say there isn't a lot, and actually.
Well, there's some people, I mean, there's a lot, you know.